Do you often feel unusually sleepy during the day, even when you've had enough rest? Or maybe you find yourself needing more of your anxiety medicine just to feel normal. These could be signs that something deeper is going on. Imagine you started taking a sleeping pill only when you couldn't sleep, but now you can't sleep without it. That's when a doctor might talk about sedative, hypnotic, or anxiolytic use disorder. This condition happens when someone uses calming medicines, like those for anxiety or sleep, too much or for too long, and their body starts depending on them. It's not just about willpower, it's about how your brain changes over time with use. Have you ever known someone who couldn't relax without a pill? This might be why. What makes someone develop this disorder? Think of it like this: you sprain your ankle and take pain medicine. It helps at first, but over time, you need more to feel the same relief. The same can happen with anti-anxiety or sleep medicines like diazepam Valium or zolpidem Ambien. One main cause is long-term use. Your brain gets used to the drug and stops, making its own calming chemicals. Also, if you are dealing with stress trauma or anxiety, for a long time you might rely on these drugs to feel okay. Some people are at higher risk if they have had other addictions or mental health issues. For example, someone with panic attacks might take an extra pill just to be safe, and before they know it, they are taking it daily just to feel normal. Have you ever taken a sleeping pill and then felt groggy all the next day? That's a common side effect. But in sedative use disorder, symptoms go beyond that. You might notice that a person needs more and more of the drug to get the same effect. That's called tolerance. Or if they stop, they feel shaky, anxious, or can't sleep at all. That's withdrawal. Other signs include using more than planned, "I'll just take one," but end up taking 2 or 3, wanting to quit but failing, spending a lot of time getting or using the drug, and still using it even when it causes problems, like losing a job or hurting relationships. Imagine a student who takes a pill to calm down before exams, but now uses it every night and skips class because they're too drowsy. That's when it becomes a problem. How do doctors know if someone has this disorder? Well, it's not just about a blood test. They ask questions like, do you feel out of control around this medicine? Or have you tried to stop but couldn't? According to the DSM-5, a doctor's guidebook, having at least 2 signs in a year like cravings, withdrawal, or continued use, despite harm, means someone might have the disorder. Treatment often starts with slowly reducing the drug. Quitting fast can be dangerous, like sudden seizures. A doctor might switch someone to a longer-acting medicine, like switching from a short-acting sedative to diazepam, and lower the dose over weeks. Therapy like CBT, cognitive behavioral therapy, helps people learn new ways to relax or sleep without pills. Support groups like Pills Anonymous also help. Think of it like retraining your brain to cope on its own with help. Can this be prevented? Absolutely. Imagine your doctor gives you a 2-week supply of a sleep medicine and says, only take it if really needed. Following that advice is key. Never take someone else's pills or use them for longer than prescribed. Try non-drug methods first, like deep breathing, a regular sleep schedule, or talking to a counselor. If you're feeling anxious, ask, am I avoiding my feelings with this pill? Education helps too, knowing that even safe medicines can become unsafe if misused. Parents can teach teens that prescription drugs aren't always harmless. Prevention is like wearing a seatbelt. Just because you haven't had a crash doesn't mean you shouldn't protect yourself. Recent studies are showing exciting new paths. Researchers are finding that some people have genes that make them more likely to depend on sedatives. If we can test for that risk early, doctors could choose safer treatments. Also, newer non-addictive medicines for anxiety and sleep are being tested, like orexin antagonists, drugs that work on brain signals for sleep without addiction risk. Apps and online CBT programs are also helping people manage anxiety without pills. One 2023 study found that digital therapy combined with slow tapering helped 60% of people stop using sedatives successfully. It's like having a personal coach in your pocket. Science is moving toward safer, smarter ways to help people sleep and relax without the trap of dependence